Hello, did you know that low back pain is prevalent in women more than in men? My name is Stella Mwende. I am a consultant physiotherapist at Stellar Physio Health and Wellness Center. The reason being, women have a wider pelvic as compared to men. This wider pelvic puts a lot of pressure, especially on the sacroiliac joint and the lower joints of the spine. Now, reason number 2 is during pregnancy, as the baby bump is getting bigger and the weight of the baby is increasing, the spine ends up getting all the strain because it has to carry that weight, and it ends up getting an hyperlordosis, which strains the lower back. Number 3, when we get our menopause, what ends up happening is there's a reduced level of estrogen hormone. This puts our bones and makes them a bit weaker, putting us at a higher risk of osteoporosis. And by the way, did you know that after giving birth, you should not carry weight or lift weight that is heavier than the weight of your baby for the first between 8 to 10 weeks. Now, this is what is causing your back pain over time as you go about your life. Talk to us. We will do a comprehensive physical and functional assessment to ascertain the cause of pain and hence be able to give you a comprehensive treatment plan that helps you fix the source of your pain as opposed to working from a symptom point of view. We are your go-to physiotherapist. Thank you.